Well, hey there, everybody. It's Melanie Potock, and we are here on the Holland Healthcare page to visit with a dear friend of mine and one of the experts in Colorado on thumb sucking. And her name is Erin Geddes, and I'm so excited to introduce you to her. But the first thing I need to know, as always, is how are all of you doing? And tell me if you're out there. Tell me, are you coming in from Texas or watching from Florida, Puerto Rico? I know we have some friends in Australia listening tonight. As a matter of fact, oh, Jill Murphy Cochran is here saying hi to you, Erin. That's so great.
Hi, Jill.
Hi, Jill. As a matter of fact, one of the people who is listening tonight from Australia is Casey from Holland Healthcare. And Casey has a fabulous giveaway. We're going to be giving away the ThroatScope and a starter pack of recyclable blades. So be sure that you read the contest rules. Casey will be posting them in the comments for you, because one of you will get this along with extra recyclable blades to start using in your practice. Really want to thank Holland Healthcare for sponsoring this event tonight. I'm really proud to be associated with them and to also get to pick and choose who I get to have on air. And when I called Erin a good 6 months ago and said, hey girl, you want to come on and talk about thumb sucking? Because you're the expert. She said, sure. So that's what we're going to talk about. Wow, so many people coming in tonight, all the way from Chile too. How wonderful. And Boston, British Columbia, Ontario, Canada. They're all here. Okay, let's go ahead and get started on a very hot topic, which is kids who suck their thumb. My friend Erin Geddes is here tonight, and she has practiced over the years in a variety of settings, from acute care, rehab hospital. She was in the NICU for a while. She and I love to talk about our days in the NICU. And she specializes in the treatment currently of articulation and speech sound disorders, oral myofunctional disorders, difficulties with feeding. She's a fabulous feeding therapist. And something as simple, that might seem simple, as what we call digit sucking, finger or thumb sucking. And sometimes that can also expand to sucking on sleeves, etc. But getting that oral input in a way that may influence facial growth. And that's what we're going to talk about right now. So Erin, I just wanted to say hi to you and say, I know you went to a lot of trouble tonight to do this for us. And I wanted to thank you for taking the time.
Thanks, Mel. Thanks for having me on. And I'm excited to talk about this with everyone.
Well, you and I love talking about this. So it's going to be hard not to have us talk for a long, long time, but we'll chat for about 20 minutes and then we'll take questions from the audience. Okay. So here we go. Let's get started with just the most obvious question, which is, when do kids start sucking their thumb? When do we want them to stop, and why?
Okay, so not to be punny, but a good rule of thumb is that we really want sucking habits, pacifier, digit sucking, to really stop around 6 months of age. After that point, it has no benefit for the child. We know that sucking thumbs and fingers, tongues, that can go on a little bit longer. And like I said, we really want it at 6 months. It can go up to 2 years. And then we're like, all right, we really need to start addressing it. 3 years, 4 years, it starts to, have an impact on skeletal development. So we're really looking at the impact on facial development then that's happening because of that prolonged habit.
Absolutely. And we know for sure that babies suck their thumb even in the womb. And I don't know if we have research on this, but certainly parents have said to me, gosh, she was, every time they did an ultrasound, she had that thumb in her mouth. Of course she has it in her mouth the moment she gets out too. And I have other parents who tell me that they never saw their baby's thumb in the mouth during the ultrasounds. And likewise, they never really picked up that habit. But babies do it to self-soothe, and it's a wonderful way for them to soothe, and definitely has benefits, as you said, up to about age 6 months. Can you talk a little bit, though, about the physiology of thumb sucking and really what happens to the brain and why kids want to continue with it? Because what do they get out of it?
Right. So, when we talk about sucking, and when we're talking about sucking, like here, I don't know if you can see, talk about the spot. So, Melanie, if you could show kind of with the ThroatScope, the spot. So that spot right there
Uh-huh.
that Melanie's putting the tongue up to it's the palate spot, the incisive papilla. And that, when they're putting their thumb in their mouths, they're really stimulating that area, that incisive papilla area. And by doing that, what's happening is that in that spot, all of the trigeminal nerve is there. So all of the neurotransmitters, so there's 4 of them that are stimulated when they're at that spot. So we've got serotonin being released, we have dopamine, we have adrenaline, and we have noradrenaline being released. So they're getting that incredible lighting up of those sensory, spots in our brains, which is causing that soothing. They are feeling more organized, more centered. As they get older and you're watching that kid sucking their thumb or their fingers or their tongue, you see them kind of zone out.
Yep.
And they're completely relaxed and nothing else exists beyond that. So that loop is really being fed every single time they are sucking. Go ahead.
No, absolutely. And I hesitate to use the word addicting, but it certainly is cause and effect. And that when I put my thumb in my mouth and maybe I'm twirling my hair too, and you can just see the kids go into another world. And we all need those moments of escaping into another world. That's called meditation. So absolutely, so important for kids to have ways to find how to self-regulate, how to calm down, but we don't want it to continue with thumb sucking past the age of 6 months. And I can see that Erin just dropped off for a second. She'll pop right back in. And I just want to keep going for all of you. So one of the things that Erin and I are going to be talking about are the structural changes that occur with thumb sucking. Especially for the parents listening, I always want you to keep in mind that when you have a brand new baby, that baby has this little round baby face. Like there's no other face like it. That's just so cute, right? You can just tell an infant, it's just beautifully round. And then as they start to grow into a toddler, it starts to be more oval-like, but still pudgy and adorable. Then as they start to move into the preschool stage, it becomes even longer and they get more of a grown-up face. That's when kids start to, here, there we go. There's my friend Erin. Erin, I was just explaining about the structural changes in the face and talking about how a baby's face is not a toddler's face, it's not a preschooler's face. And that once we get to that preschool stage, have you ever noticed that's when people start saying to you, he looks so grown up. It's because he's getting more of an adult face. And not only is the musculature beginning to change, but the bones are beginning to shift. And the muscles play a role, depending on how hard they pull on the bone or press up on the bone, as to how that face is formed. When kids have a thumb in their mouth for long periods of time, especially into that later year of the first year of life, and Erin, please expand upon this, but it will actually begin to change the shape of the palate, which is connected to everything else, and begins to shift the rest of the face. And you start to lose some symmetry, as well as some other things that we'll be talking about in a second. Erin, anything you wanted to add about that, how it changes facial structure?
Right. So when we're talking about that, because like you said, we need that. So our tongue, like Melanie had shown earlier with her tongue up to spot, so our tongue should be up there, right? So go ahead and show them, Mel. So our tongue should be resting up there all the time. And then it should be lightly kind of suctioned up so that, the tongue is helping expand that palate into a nice U-shaped palate. So just like Melanie's demonstrating. So it's, that's where our tongue should be naturally just kind of hanging out and resting. When we have our thumb or our fingers in our mouth constantly, and we're pushing, that's the force that's on the roof of our mouth. Then instead of having this nice U shape, all of a sudden it's starting to just get more and more narrow and higher. And so that higher part that's being pushed into that nasal cavity. So that's when we start to look at and see, okay, there's going to be some airway issues with that because we don't have a nice open airway anymore. It's narrowed. So it's really starting to affect that. And then it impacts our teeth. So now you have to think that now we're 4 and 5 and we've pushed the palate up, and now we've got, problems with our dentition that starts to happen because we're stabilizing that thumb or the finger or that tongue sucking, right? So that's starting to put us into like a crossbite, an overjet that sometimes happens, or we've got, an open bite because the thumb or fingers are in the mouth.
Right.
So, and that's usually, like I said, when the dentists are really starting to pick it up too, and the parents start to get even more concerned.
Yeah, and we really want to catch it before all of that. Oh, Erin, I think your speaker might have come up a little loud. Just if you don't mind just turning it down, because it's
okay.
Me too. There we go. Can you hear me okay? Great.
Yep. Is that good?
Yeah, technology, no big deal.
I know. Sorry, guys. Yeah. I'm yelling at you.
So now we've talked a little bit about when kids should be stepping away from the thumb sucking, and we've been talking a little bit about why that's so important, especially as they grow, and the facial changes it'll make. And Erin mentioned also that when we start to shift the changes in the facial structure and the bones and the muscles away from the way nature intended this child's face to develop, we then can create problems like problems with airway or problems with eating, because it's really hard to swallow correctly when you have a really high narrow palate. And part of the reason why kids develop narrow palates, there's several reasons, but one significant one is because they continue to push their tongue forward to swallow rather than up to that spot and swallowing with the tongue up on the spot and this beautiful peristaltic wave that just sends the food down. We like to see children develop that around 12 months, maybe 14 months at the latest. And if they're sucking their thumb, they can't develop it because their thumb or their fingers are holding that tongue down all the time. So they continue to learn to keep their tongue under these digits while they're swallowing. And these kids will often come to Erin and I with their parents, and their parents will say, he's 3 years old and he's like such a picky eater. And one of the first questions we ask is, does he suck his thumb? I always want to know that. And then I'm taking a look with my throat scope at the palate and the dentition. So I think for many parents, thumb sucking just feels like, a lot of kids suck their thumb for a long time. What's the big deal? Not realizing what an impact it can really have on facial structure and consequently airway and other behaviors like picky eating. So that brings to mind, though, Erin, can you talk a little bit about frequency and intensity and duration and how those come into play? Because certainly some kids suck their thumb and we don't see as big an impact, and others were like, doesn't seem like they suck it that much, but then they're so intense in the way they do it, it can really make a difference.
Right. So Melanie, that's one of the questions we always ask parents to start paying attention to: frequency. How often are they sucking? The intensity is just what you said, is just that, how forceful are they sucking when they are sucking? And then the duration, how long are they sucking when they're sucking? Are they just, putting their thumb in their mouth to go to sleep, and as soon as they fall asleep, the thumb is right out? Or is it in the entire night, or the entire time they're watching a movie or the entire car ride? And are they really sucking with a lot of force? So we're really looking at those 3 things: the frequency, how often, intensity, and then the duration of the suck patterns.
And Erin, even if they don't seem to suck that intensely, if it goes on for year after year, let's say 8, 9, 10, 14, I know kids who are teenagers and some adults who still suck their thumb. How much of an impact will that have, or is it dependent on other factors?
No, it continues. It has that impact, again, because we're saying that those hands, those fingers are in that mouth holding that tongue down, and it continues to change the structure of your face and of your dentition into your teen years. So a lot of teens come to me because, hey, it's finally time for braces.
Yeah.
And they can't get braces on or get braces off because they're still sucking constantly. Or they're an adult and, hey, we had braces and now we're in an orthodontic relapse situation because that that sucking continued. And then also, again, as you described, because you've got that low forward motion of the tongue, that's not in that correct swallow pattern at all. So you've got all of those forces working against you during this time.
Absolutely. So Erin, talk to me a little bit about triggers, about like, what is it that causes a child to suck their thumb, and why is it that some kids suck their thumb when they're riding in the car and others don't, or that other child might just suck their thumb to go to sleep? Like, what's that about? Why is there not a perfect pattern?
Right. And that, like you said, that goes back to having the parents really look at during that time when you're talking about, hey, it's time to stop, right? And you get ready to approach your child in a very positive way. We really want to look at, again, those triggers. So the frequency. So I always say triggers is really equal to that frequency. So are they doing it only in the car? Are they doing it only at nap time? Are they doing it during TV time, during book reading time? Or are they doing it at school, not at school? So really looking at that frequency, because those will be their different trigger times that we're going to be looking at. And sometimes those triggers are paired with a sensory object, yes, right? Like a blanket, a lovey, a tag, hair twirling, earlobe, face rubbing,
Sure.
Yeah, they love to rub that upper lip or the side, right up here by the nose rubbing when the thumb's in the mouth or the fingers are in the mouth. Mm-hmm. So we never address those sensory issues in terms of if it's a rubbing, because we know, Mel, that once we really address the oral habit, the rest of it will go away. Now, if we know that like a lovey is really attached, and every time that kid has that lovey, that thumb is in the mouth, we usually say it's time to let the lovey have a little vacation.
Yeah. Yeah.
And then that's when we would start to address.
Sure. And one of the things that I always think about too is when the parents are having trouble figuring out what the pattern is, to record when they see it happening, and also to look at what happened right before it happened. It's easy for us to think about, oh, it's when she's on the bus, but maybe it's really that she had a very stressful math class, and math class only happens on Monday, Wednesday, and Friday at the end of school. But on Tuesdays and Thursdays, she might suck her thumb a little bit, but not that much, but really intensely Monday, Wednesday, and Friday. So it requires some detective work, because maybe there's a lot of anxiety around math, or maybe it was just very stimulating and super fun, and she's trying to find a way to calm down and self-regulate. So is part of your treatment plan then to help these kids find other ways to calm down and regulate? And what would some of those ideas be for parents who are
right? Yeah, and that's great lead in, Mel. So we look at like that, like what are the frequencies, what are the triggers, and then how do we support that? So we really need to look at why the thumb sucking is occurring. So not only when, but the why of it is super important. And we know that there's, with thumb sucking comes a kind of a highly associated with airway issues or tethered oral tissues. So, a tongue tie, lip ties. We really want to make sure that all of those have been ruled out
Sure.
while, before we really say, okay, it's time to, to start eliminating this habit, right? And when we start to eliminate that habit, some fun ways to do it is to, first of all, you need to make sure the kid has buy-in, right? Like they have to decide that it's time. I mean, it really needs to be their decision. They need to have ownership over it. And furthermore, they need to know it's going to be so much fun. Like it is such a fun experience. And every kid feels so empowered. Their self-esteem goes up and they realize that they really can do hard things.
Yeah.
And, and so one of the ways we start to address that, right, is it's easy to say, well, we can give them some jewelry to chew on to kind of, replace a thumb or a digit. But really what I like to do with the kids is really get them started on putting that tongue up to spot and getting more and more aware of where that spot is, because that's where it's all happening. I mean, that soothing feeling that they get is because they're activating that spot. If we can get their tongue to do that, which is what Mother Nature had intended it to do, then we're getting there even quicker. Some other things that, obviously we talk about doing is the reward parts, right? Like really making it just an overall fun experience for these kids. And then once they know to get that tongue up the spot, we're using barriers to help them along the way. And by barriers, what I'm talking about is like, thumb guards, finger guards, Band-Aids, fun Band-Aids. With some of my older kids, I am really big at I'm like using rings, like really big, something that they have to take off in order to get to that finger or thumb. Some of my kids love using their baseball batting gloves at night or during the day when they are ready to suck. And then we really center it around, like you said, like what were the triggers and how can we go about changing those triggers? What are some other things we can do? If it's an older kid and we're talking about anxiety, let's start addressing where that anxiety is and, what we can do with that in terms of, giving them some real tools for that, whether it's some deep breathing, some yoga.
Right. And whether it's even just learning to put your tongue up on your spot, Erin, as you know, I work with a lot of children with avoidant restrictive food intake disorder and anxiety around eating. And one of the first things I teach them is how to make sure that their tongue is up on their spot, because when you're pressing on that spot throughout the day, and these are kids with high anxiety all the time, 100% of the time, I feel comfortable telling everybody this, these kids report to me, I feel better. And often they haven't kept their tongue up there. They may have more of a low resting posture, but because their anxiety is so high and they start to press on that magic spot that we've been talking about, and all of those neurotransmitters are released that we chatted about, they feel the difference, maybe more than, the average person, because their anxiety is up here. And so it makes a real difference for them to kind of bring it on down. Now we do a lot of other work too, but ever since I started doing that, I am just 100%. The kids say, I can really feel that.
Right. That's how you get them to stop the habit, right? Is you've got to replace it with what Mother Nature got it intended, was that tongue up to that spot.
Yeah.
And that starts to relieve all, like you said, that serotonin, the dopamine, the adrenaline, the noradrenaline. And it's that noradrenaline that helps bring those high anxiety kids down.
Yeah. Yeah. It's the happy spot.
It's the happy spot.
Well, you know what, Erin, I am just blown away with how many questions we have rolling in. So would you do me a favor? And I know that you consult with families outside of Colorado and you also treat kids here in Colorado. So would you just share with everybody just a little bit more about your background, but also how they can get a hold of you? And while you're doing that, I'm going to start popping questions up on the screen.
Okay. So my background is I am a speech language pathologist, like Mel stated in the beginning, and I work primarily with speech sound disorders, orthodontic relapses, and I really specialize in pediatric feeding as well. And this is near and dear to my heart because so many of these kiddos that do thumb and finger sucking also, are ones that are not wanting to really chew their meats and have a really well-rounded diet. And so I see a lot of those. So the best way to get in touch with me is either my website, which is just www.Geddes, my last name, therapies, plural.com, or you can email me at my name, Erin, at GeddesTherapies.com, and I would be more than happy to answer questions, chat, whatever you guys need.
You're the best. Thank you. Well, I thought this was a great question because we often hear this question and it makes sense. Right. My oldest never had a high, narrow palate, but my middle one does. How much of the structure is genetic? And of course, we're not otolaryngologists, although just 2 days ago, we had one of the nation's top otolaryngologists speaking about this. So I'll be sure to include it in the video when I put it on my YouTube channel. I'll include that link for everybody. And I'll include the link here when I comment later. But side note, Erin, I know, though, that you're pretty familiar with this. You just talk a tiny bit about how much is genetic and how much is it that outside environment, meaning sucking on the thumb, and the duration and the intensity is influencing genetic propensities?
Right. So yeah, so again, let's go back to just that. So there is a genetic component, right? So if we look at that highly associated, airway issue or the tethered oral tissue that causes these kids to want to suck for prolonged periods of time. So when we're looking at that, we see that there is a genetic correlation. We know that with tethered oral tissues. And so when we're looking at genetics, we have to think about, so maybe they did have a little bit higher palate, but we also have to look at, was there any airway issues earlier on that caused that low forward tongue placement? And again, that finger digit sucking. If they were never sucking, never had their finger or thumb up there, but still have a really high palate, I mean, you have to start really, like I said, more investigating, was there an airway issue as well?
Right. Airway has so much to do with the formation of the face and the airway itself. We have to remember that when speech pathologists talk about airway, they're talking about from the moment we begin to inhale through our lips to the moment all the way deep into our lungs. So that's quite a pathway. And all of that can be influenced by the way our face is formed and also the way our thoracic area is formed. So absolutely, we have to look at genetics as well. And of course, for example, my family, we all tend to have really long, narrow faces anyway, but some of us may or may not have needed braces. We still want to be conscientious of the fact of what does our palate look like? Is it a little bit domed? Like ideally, has it started to elevate? Perhaps it's elevated on some of my brothers, for example, because they have a little bit of a tethered oral tissue. And a little bit isn't even the right way to say it. They just have a tethered oral tissue. It's amazing how many of us as adults have learned that, oh my gosh, I actually have a class 3 tongue tie. No wonder I've been having problems with this. So, it does take, as I said, quite a bit of detective work. And I think this is an excellent, excellent question. We have another great question here from Debbie. She says, do pacifiers have any of these same concerns? And the answer is yes and no, right, Erin? Go ahead, take it away.
Yes, it has the same concern, but it's also right. Like a pacifier is a little bit easier to get rid of, right? I mean, Melanie has some great ways to get rid of pacifiers on her website, and so that makes it, I should say, a little bit easier. By a little bit, I mean you still need to investigate the why of it.
Sure.
And I keep going back to that because I think it's so easy to say, let's get rid of everything, including pacifier, without really knowing the why behind it. And making sure that, like I said before, airway and tethered oral tissues has been ruled out or addressed. But yeah, and the other is that when you have a finger or thumb, I mean, you've got bone on bone.
Yeah.
Where, like I said, the pacifier, it's a little softer. Sometimes the kids, they'll place them kind of funky ways as they get older. So you'll start to see the dentition change. To me, in my practice, I haven't seen the dentition change as quickly with the pacifier as I have with a finger or thumb sucking habit. So those are a little bit of, anatomical differences between the pacifier and the thumb. And I don't know if you have anything else, Mel, that you think.
Well, it takes me back to you and I, early days in the NICU. A pacifier has a lot of benefits, especially for babies who are preemies or have medical challenges, especially our kids who really need that sensory input. And of course, also there's very strong studies that show that it helps alleviate SIDS. But we don't want kids to continue with a pacifier past a certain age as well. Now, the American Dental Association says up to 2 years. The AEP talks a little bit wishy-washy around 18 months. But a certified orofacial myologist, like my friend Erin and those myologists who have taken courses on it, Erin will tell you 6 months. I will give a little bit more, and then I'll say 6 months to 9 months out of the crib. and then totally gone by 12. In a perfect situation, I want a baby to be done with their pacifier at 6 months, during the daytime, and then wean them off the nighttime pacifier so they're all done with that by 12. And the only reason why I give a little bit of leeway is for the exact same reason that Christine is answering this particular question. I'm going to pop it right up here. She said, so if thumb sucking / pacifier sucking should be phased out after 6 months, how do you suggest replacing that sensory input so they don't develop another negative oral habit to replace it? Just to piggyback on my last comment, sometimes when we try to take it away from a little one at 6 months, they aren't getting enough oral input in other ways yet. We might be offering them chewy tubes, they're beginning to eat, but they may need more because they're starting to get some teeth, and they will often, if they've got a pacifier, put that thumb right back in their mouth. And in that case, if I can't substitute it with something else because they're so young and they just need more, I'll continue with the pacifier for a smidge longer, but being very, very careful not to reach for it every single time, to find some other strategies, even gum massage, etc., to get that deep pressure, that proprioceptive input that these kids really need to help them calm down. Then we'll try it again, maybe 3 or 4 weeks later. But could you talk, Erin, a little bit about thumb sucking in particular and some ways that we can replace that sensory input for children, maybe not as young as 6 months. So I think I kind of covered that, but a little bit older.
Right, but a little bit older. Yep. So some of the ways that we're replacing that, in the older child, is that we're really trying to work on, let's say they're eating table foods, right? Again, let's go back to, we're making sure that they're able to eat a variety of foods, right? In terms of texture, crunch, so that is super important, and that gives us some of that feedback. The other ways we're doing it is, as Talk Tools has wonderful, the Sensi Vibe, and really rubbing those along the gum lines, doing a lot of that just stimulation inside the mouth with just oral exploration of different toys, of different textures, so that they're really getting that input that we want to give them at that time. So we're really wanting to replace that thumb, that finger, that pacifier with other things in their environment now that they need to be playing with and thinking.
And if I can give everybody a tip about if you are going to use any sort of chewy toys or jewelry, we call them, they often will come with a necklace, kind of like that I have my TelScope on. And I want you all to think about this for a second. If I have my chewy necklace on and I put it on, just like Erin, don't look at your necklace right now, but I know you have a necklace on because I can see it. But if I turn to you, Erin, and I say, oh, Erin, that's a really pretty necklace. How often do you go to kind of, what necklace did I put on this morning, right? We all do that. Oh, this is one my husband gave me for Valentine's Day. Thank you. I have moments like that all the time. I can't remember what jewelry I put on. I don't even remember I have jewelry on. It's the same thing, especially for our older children who were using jewelry to help them get that oral input. They forget they have it around their neck. So when parents order any sort of chewable necklace or something for them to chew on with a breakaway lanyard for safety, I usually recommend that they actually order 4 or 5 of them, one for every member of the family, because seeing the jewelry on Aunt Erin reminds me, oh, I need to chew on this and not suck on this. Seeing it right on mommy can say, oh, I need to chew on something, and model that and cue, and the child then goes, oh yeah, me too. So we can start to provide that model for the child rather than take your thumb out of your mouth. Right? You've got your necklace. They just forgot they have their necklace on. That's all that is. They just need a visual reminder, and the reminder is it's hanging on everybody else's neck.
Absolutely.
Let me see what other questions we've got here. This is a very interesting comment from Cam. Thanks for sharing this, Cam. She said, my child sucked his thumb so hard that he had sores and moved his top jaw forward. He has had full sinus and surgery and enlarged tonsils and adenoids. He stopped after surgery, but he picked it up about 2 months later. What would I do? I know you've had kids on your caseload like that. Can you speak to that, Erin?
Oh, absolutely. And Cam, that's a great question. And again, this goes back to that tongue resting posture and going up to that spot. So because they had that airway issue, right? We corrected the airway issue, but we never corrected the resting position of the tongue and taught, your child where that tongue needs to be resting. And really helped just that neuromuscular re-education that needed to happen afterwards, which is why it's so important to kind of pair with an orofacial myologist that's in your area, that can kind of help with that.
I just want to talk about that for a second because I haven't really been clear with everyone. And Holland Healthcare often allows me to bring on specialists that are certified orofacial myologists because I just think they're God's gift. And although I've taken courses in orofacial myology, sitting right next to Erin for several days, Erin went on to become certified. I'm very grateful that I have the knowledge, but I will always refer to a therapist here in Boulder who's also been on Facebook Lives with me, or Erin, who lives about an hour away from me for kids who are a little bit more down south. And that's because she's a certified orofacial myologist. That means that she's taken the test, she's put in the time, she's done what we consider almost like an internship in it, where you've been supervised and actually have someone who's been in the business for a long time observe you and make sure that you know what the heck you're doing. And that's why when a parent comes to me and says, I've got a kid who's 8 years old and I can't get him to stop sucking his thumb, I can give some very basic advice. But if we don't have any success with that, I send them straight to Erin. So I'm so grateful to have you here. So on that same note, by the way, Anna has a similar question. Do you have any recommendations for a child, age 5, who's doing well with treatment? She's in an alpha appliance. Structure and palate has improved and didn't suck during the day, but recently, let me just finish over here. Recently decreasing nighttime sucking, but has weekly tantrums in which they are unable to calm and regulate without sucking their thumb. Any suggestions for alternatives during highly emotional dysregulation? Erin, can I start before you answer?
I knew you'd want to. This is
I want to. You know, I
knew you'd want to go.
Well, because I'm going to say the hard part for Anna. It is extremely hard when your child is so upset that they can't calm down. It is like, as a mom, rip your heart out and stomp on it. I've been there.
Yeah.
However, and Erin's great at this. She's going to give you some good tips. But one of the things to always keep in mind is what we can't do is give her something to calm down that makes her calm down right away, like the thumb. Because what you'll learn is the more upset she becomes, she'll become so upset that these other strategies won't work that well, right? And now everyone's just in emotional turmoil. But the moment somehow she gets her thumb, or maybe we give in out of angst and say, go ahead, have your thumb, it suddenly stops. What that does is it creates a cycle in her brain that she goes from 0 to 10 so that she can get the thumb. And it's not that she's being manipulative. It's that that's really what works for her brain. Her brain has learned that's the only answer. But Erin has some other alternatives that may take a little bit more time. But if I can just stress one thing, it's trying to use all these other strategies and not giving into that thumb. Go ahead, Erin.
No, I was just going to say, again, this goes back to what you were talking about too, when we were discussing earlier about that frequency and when the sucking happens, kind of what happened before the sucking needed to happen. So looking at that, right, that antecedent before the behavior. Mm-hmm. And ways to start replacing that. So, and Mel, you jump in at any time, please. But so some of the things that I would recommend during these peak tantruming times is looking at, let's, like Mel had said, videotape or keep a log of what is happening right before the tantruming starts to happen. And then what are some ways that you can start teaching her how to soothe, how to, like, again, what we were talking about, get those endorphins down. And that's, that's one of the areas where it's like, if she'll start to do, the jewelry, where it's like, all right, or, we give them, a couple of other things they can start to chew on during that time, and so that we're catching it and replacing that thumb with something that they can actually hold and put in.
Before it escalates.
Before the escalation. So you've got to catch it right before. So that you're ready with that item. With some of my kids, the P grabbers are excellent for that, because they can just grab a hold. And yeah, Mel, do you have one?
I might. Yeah. Go ahead. Keep talking.
So it's great because they can grab a hold and just really put that pressure as they're biting, and and giving some more of that, just that deep stimulation that we need. So they can put in and start biting around instead of just tantruming, because sometimes they just need that that we can get.
I love these on a breakaway necklace, excuse me, just for safety's sake, because you can just loop them right through and they are there. And you'd have to be a T-Rex to break this thing. Like, they are tough. And the kids need that deep input to calm down. I do want to mention one last thing around that, Anna, because I just think it's such a good question, and something that a lot of parents deal with is, one of the things that I have found really helpful with, especially my highly anxious kids, that I have kids on my caseload that cry a lot. They love me, but they just are very, very emotional kids. And what I'll always say to them is, it is really okay to cry. You need to let that out. Let those feelings out. We can cry as long as you want. I'm right here with you. And so in other words, it's okay to have those feelings and learn eventually another way of dealing with it, that putting the thumb in the mouth, I think we do that to get the feelings to stop. When really one of the things we want to work on is, it really is okay to feel that rotten and just want to yell and scream and have a moment. Wish we could all do it more as adults, especially in 2020. We're going to take one more question here, and then I'll do my very best to go in and answer everybody's questions. And Erin, please feel free to go in from your Facebook page, Geddes Therapies, if you'd like to, and answer any questions as well. I'm sure everybody would like to follow you. But let's, here we go. This is a very interesting question from Christy. Christy says, foster mom, yay, we love you. And early intervention teacher, all the love. Any information on the process to support a child with a trauma background that relies significantly on thumb sucking. He's decreased from all day, all night to times of stress, sleep, car rides. But times of stress and anxiety is frequent. The intensity is really obvious, making clicking sounds because he does it so intensely. Also, he has a history of laryngomalacia, tracheomalacia, laryngeal cleft, and obstructive sleep apnea. That makes a lot of sense given his history. Yeah. Why don't you go ahead and then I'll add a few things.
Well, actually, this goes back to, when is it the right time to be stopping, slowing down? Sometimes those car rides, especially with foster kids, is that they don't know what they're going to be in for. And a lot of times those visits to family members and then going back to the foster family can be very highly stressed situations. So I think this also goes back to what Mel had said earlier about, validating those emotions, those fears, that feeling, but you're also dealing with airway issues. So, that sucking sometimes needs to happen, right? But depending, and I don't know if you told the age, I didn't see the age up there,
no.
Christy. But again, I always go back to, right, the spot. The spot is where the magic happens. But you've done a really great job already starting to move him away from that. But I go back to, he may be one that we could easily replace a Chewy with in the seat or, in those high peak stressful times.
And Erin, tell me if you don't agree with me, because I'm just brainstorming with you a little bit to help Christy. I think this is also kind of what you were saying as well, is that I wonder with a child like that, especially if he's able to verbalize some of these feelings, whether he's 3, 4, 8, 9, 10, that maybe we help him gain some control over when he can suck his thumb, with the understanding that eventually you won't need to suck your thumb anymore. But this is a big transition you're going through right now. If you can think of 3 times during the day where you'd really like to be able to suck your thumb, what would they be? And maybe we eliminate all the other times, and for those 3 stressful times, like you said, maybe it's the car ride, he's sucking his thumb. And once we have that habit established and you feel like things have really evened out, then to say, you're doing amazing. You only suck your thumb here, here, and here. Let's figure out which one of these could go away, and we'll stick with just 2 and give him that chance until we get down to just 1 situation. And that's where an otolaryngologist and a certified orofacial myologist can really work together to eliminate that final scenario, that final trigger that creates the thumb sucking. But with his medical history, that
Right.
may really be coming into play here. You're more than welcome to tell me if that was just the dumbest thing you've ever heard. Because you're my friend and you would tell me.
I know, right? No, I was like, this is why I love Mel. We think she's so smart. But yes, he needs some control.
Yeah.
And offering him those choices of times to suck is very, very acceptable, very doable. And it's one that, like I said, especially if he can start to verbalize that, I think then he will start to want to maybe move away, especially if you start to let him know that there's other ways we could start to deal with those stressful times, and verbalize that is super helpful.
Well, this whole event, having you here, has been really helpful for me. You've got me thinking a lot. And I'm hoping for everybody listening, it's been very helpful for you too. And if so, will you please share this video on Facebook groups, on your personal Facebook page, because this is probably one of the most common issues parents run into. And I think when they understand the bigger picture, how it can affect facial growth, airway, et cetera, that this might motivate them to reach out and get help from someone like Erin, a certified orofacial myologist. So thanks, my friend, for joining us tonight. And thank you to all of you who joined us too. We had such a big crowd because it's such a hot topic. And as soon as we're all done here, I'll go in and start answering some of the other questions that popped up too. Everybody's saying thank you. That's so nice. All right. And thank you too to Holland Healthcare, the inventors of ThroatScope. And now, if you don't already know, they have the new TelScope oral health system. You got to check it out. So we'll put the link in the comments for you. Good night, everybody.